Here's how a typical session would go at Clinique Active Action. We have an athlete here that came in with a CF ligament sprain at the ankle. And we want to test all the muscles around that ankle, as well as check the ligament integrity. But what's more important is figuring out why that ankle sprain happened in the first place. So we want to test actually above. So here we can see that on the left side, the glute is testing weak, or that hip extension pattern. So our goal is, one, can we reduce the inflammation, increase or speed up tissue healing at the ligament? And also, can we reactivate this glute so that this person can get back quicker into their sport? Another way we want to reactivate the glute is we found a compensation pattern at the neck on the left side. Since the base of the neck is part of the posterior chain, we're using some of these trigger points to see if we can reactivate the glute as well. With the shockwave therapy, we're putting the ligament on a slight stretch. And since this ankle sprain happened about 7 to 8 days ago, we're going to start with a softer tip or less intense tip. And we're just going to go send sound waves right into that ligament. Also having pain at the ligament in front of the fibula, anterior talofibular ligament. So we were also shock waving a bit in there. The goal of the shock wave is to reduce the inflammation, increase circulation, and this will help speed up the healing. And then if we retest that left side, we can see that the athlete got stronger and we cannot lift that hip up anymore. So it's super important to test, assess, treat, and then we always retest after to see if it made a change.